Welcome, everyone, and thanks for tuning into our webinar called Checking In on Canadians. I'm so glad you're here with us today. My name is Shauna Major. I am Dataset Manager and Knowledge Mobilization here at Mental Health Research Canada. I'm joined by some of my wonderful colleagues to bring you today's virtual event. First, my co-presenter, Claire, is our bilingual manager of partnerships. Behind the scenes is Brittany, our senior manager of communications, and Michael, our vice president. Over the next hour, we will be taking a close look at the last 6 months of Canadians' mental health, highlighting some of the major findings from polls 25 and 26 of our national poll. We'll also be giving you a sneak peek at what's coming up next for MHRC. Before we proceed, I would like to acknowledge the land. As a national organization, MHRC's work spans many Indigenous territories across Canada. MHRC is based in Toronto on the territories of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many First Nations, Inuit, and Métis communities. I am joining you today from the traditional territories of the Three Fires Confederacy. We are grateful for the opportunity to work and live on these lands. On today's agenda, after a couple of housekeeping items, we are going to discuss 4 relevant topics to the mental health of Canadians in 2025, the use of AI for mental health support, self-stigma, men's mental health, and opioid use and mental health. Following up on those 4 themes, we'll be giving you a sneak peek of our brand new Data Hub, a free online tool that you can use to explore mental health data. I invite you to stick around for our interactive question and answer session at the end of the webinar. At any time during today's session, please feel free to submit your questions in the chat. My colleagues behind the scenes are keeping track. Before we dive in today, a few housekeeping items. Today, we will be discussing mental health in general, though we may touch on some topics that are sensitive or challenging for some. If you feel that at any point that stepping away, pausing, or taking a break would be in your best interest, that's okay. Please do so. Today's session is being recorded and will be available on our website in the coming days, along with the presentation deck. We also welcome you to reach out to us if you have any feedback about today's event, ideas for future webinars, or if you didn't have a chance to ask your questions, email us at info@mhrc.ca. I'm going to hand over the virtual mic to my colleague Claire to tell you a little bit about Mental Health Research Canada and the work that we do here.
Thank you, Shauna, for this great introduction. So let's dive right in. So the purpose of this webinar is to share with you our latest findings on Canadians' mental health. But beyond that, it's also to share with you an overview of our population polling project. We regularly collect new data on new topics that are related to new trends, new events, or current news on mental health. And this is something that you might want to stay informed about in the future. So a word about us, Mental Health Research Canada, previous slide please, thanks Brittany. Mental Health Research Canada is a national charity, and our mission is to improve the lives of Canadians by advancing mental health knowledge. Now we do that through 2 main branches. The first branch helps providing funding for innovative research through grants and studentships. And the branch that we'll talk about today helps providing resources for data-driven decision-making. And we do so through our national population polling initiatives. So each quarter, we launch a new survey in order to collect data on Canadians' mental health. Every time 4,000 Canadians participate, they are aged 16 and above from all across Canada, and we try to have a sample that is representative of the national population. Since this project started back in 2020, we've been collecting data on Canadians' mental health every quarter for 6 years now. So we've collected data from over 80,000 Canadians, I read here, but I know, and I think I've heard my colleagues say, almost 100,000 Canadians now. So we collect data on 4 main categories of indicators. We first ask the participants questions about their socio-demographic profiles. We know their age, gender, if they identify as a visible minority belonging to LGBTQ plus communities, if they are newcomers to Canada. We also ask them where do they live, which province, if they live in a rural or urban settings, etc. Then we ask some questions about their mental health status. We have some data about symptoms of anxiety, symptoms of depression, suicidal ideation, but also burnout, absenteeism, presenteeism. And then we look at behaviors or factors that could be related and associated to their mental health status. So, for example, we look at their behaviors regarding gambling, substance use, but we also look at their social settings. Are they isolated, or do they have people they can count on? We also look at their screen time and other behaviors or factors that can influence their mental health. Then we look at their pattern of access to care, which means that those who need care, are they able to access care? If they access care, which type of care do they access? How is it funded? Does it satisfy their needs? And if they need care but are not able to access it, what barriers did they face that prevented them from accessing the care that they needed? So our finding is actually available in our website. You will find our public reports on our website, and you will also find an interactive my colleague Shona will actually demonstrate to you later in this webinar. You can also access our raw data sets. For example, if you're a researcher and you would like to look at specific demographic groups that we may not have analyzed yet, you're welcome to contact us and then request access to our dataset in order to do the analysis yourself. So we will now, thank you, perfect timing, present our major findings for the two previous population reports that were released, polls 25 and 26. And I will let my colleague Shauna start us off.
Thank you so much, Claire, for that comprehensive overview of our work and what we do. We're going to kick it off today with a discussion about some of our data around AI use for mental health support. Next slide, please, Brittany. So in July of 2025, we found that around 1 in 10 or 12% of Canadians reported using AI tools to support their mental health or well-being. If you take a look at the blue chart, you'll see that this 12% includes two groups. 8% that said that they intentionally used an AI-enabled tool, while another 4% said they used a mental health tool or app, but were unsure if AI was involved. Among those 12% that used AI tools for mental health, 84% told us they found them effective in helping them manage their mental health or emotional well-being. That's a strikingly high proportion, especially for a technology that's still relatively new and being tested in the mental health space. Next slide, please, Brittany. Diving a little deeper into our data, we found that the use of AI tools to support mental health was not evenly distributed across the population, but highest among Canadians under 35, as well as racialized and LGBTQ Canadians. A deep dive suggests that these groups are using AI as a tool to bridge gaps in access to mental health care. We know from our broader data collection and from listening to stories of lived experience that younger, racialized, and LGBTQ Canadians face barriers to care such as affordability, long wait times, and difficulty finding care that feels safe. Seeing higher AI use among these groups may be an early sign that it's a tool that's helping them navigate and overcome these barriers of access. We're also seeing some early signs that AI is being used as a complement to existing supports. For example, in our data, we see that 1 in 4 youth who are already accessing some type of mental health support are also using AI, suggesting that they may be turning to these tools to deepen their understanding, but not as their only support. Next slide, please, Brittany. Despite this growing use, public trust in AI tools for mental health support remains low at only 17%. Among people who actually used AI tools, 6 in 10 said they trusted them, while 3 in 10 still have some doubts. If we take a look at the infographic on your screen, you'll notice something interesting. While trust levels differ dramatically between the general public and AI users, their doubts are much more similar, where 41% of the general public said they have some doubts, compared to 34% of AI users. Overall, this data is telling us that despite some hesitation around trust, many Canadians are using AI and they are finding it effective to help fill gaps in service access and complement some other mental health supports. Next slide, please, Brittany. We're going to move next into a topic closely related, mental health stigma. Next slide, please. In November 2025, our survey found that 1 in 3 Canadians who have been diagnosed with a mental health condition are embarrassed or ashamed because of that diagnosis. When we asked how that mental health condition was impacting their lives, 1 in 3 said that they feel out of place in the world because of their mental illness, they felt inferior to others, or they felt disappointed in themselves. Nearly half said that people without mental illness could not possibly understand them. We found that these indicators of stigma towards mental health diagnoses were higher among men and among Canadians under 35 years old. This data suggests that stigma towards a mental health diagnosis, particularly self-stigma and self-blame, remain deeply rooted, even as public awareness and conversations about mental health continue to happen. Next slide, please. A topic closely related to self-stigma is comfort discussing mental health. Our data shows that Canadians with mental health challenges feel less comfortable talking about their mental health with others. Drawing your attention to the infographic element on the left, with level of comfort in blue and level of discomfort in red, you'll see that 68% of the general population said they felt comfortable talking about their mental health. However, looking at the categories with those symptoms of anxiety and those symptoms of depression, those people were feeling much less comfortable talking about their mental health, with the number settling around 50%. Looking at the chart on the right, our data also tells us that younger Canadians are feeling less comfortable talking about their mental health, which is another group that we know from our data collection struggles with higher levels of anxiety and depression. We also see a connection between comfort discussing mental health and social support. Canadians who feel comfortable talking about their mental health are more likely to report having stronger relationships and are more likely to say that they have supportive people around them. While we cannot say that strong relationships cause greater comfort in discussing mental health or vice versa, our research consistently shows that social support is one of the most important protective factors for your mental health. So overall, what we're seeing in this data is that stigma, especially self-stigma, continues to shape how people see themselves and their level of comfort in speaking about mental health. I'm going to hand the virtual mic over to Claire for an overview of our data on men's mental health.
Thank you, Shauna. Such interesting topics. So I'm going to talk about men's mental health. Now, men's mental health is a topic that has gained increasing attention over the past months, as there are some interrogations regarding men's overall well-being. I would say that one visible illustration of this is the growth of masculinist content on social media, where some young men openly express frustration and a sense of marginalization. So looking at some young men's mental health could help actually shed the light on some of the challenges that these young men face in our current context. This is just one example that shows that this topic is relevant in the current context. But now let's dive into the broader trend on men's mental health. So the first thing is that we can see that men are more likely than women to show signs of alcohol and cannabis dependency. So we measured it using the audit and credit questionnaires that are validated screeners measuring risky or harmful alcohol use or harmful cannabis use. So you have the results for the women on the left and the results for men on the right. Now, if we start with women, the two first columns on the left, we can see in blue that 4% of women show signs of alcohol dependency, and that 4% of women in red show signs of cannabis dependency. Now, if we look at men, the two first column, we see that 7% of men show signs of alcohol dependency, and that 9% of men show signs of cannabis dependency. So what we see here is that men are twice more likely than women to report signs of alcohol or cannabis dependency. And this is especially women under 30, as 11% of them show signs of alcohol dependency, and even 18% of them show signs of cannabis dependency. So overall, no matter the age group, men are more likely than women to show signs of alcohol or cannabis dependency. Another topic is about suicidal ideation. And we see here that men report higher rates of suicidal ideation than women. So on the left again, we have women, on the right, men. Let's look at women in the three first columns. In blue, we can see that 11% of women have thought about suicide in the past year. And another 1% in red made a plan of suicide. So in total, you have 12% of women who either thought about suicide or made a plan of suicide in the past year. Now, moving to men, we see that 14% in blue of men thought about suicide, and that another 4% of them made a plan of suicide, for a total of 18% of men who thought about suicide or made a plan in the past year, which is significantly higher than 12% for women. Now, among the younger generation, under 30, although they are the most likely to report having suicidal ideation, the gap between women and men is not that big. I would say that the gap tends to be bigger with age. As we can see that women in their 30s, among them, 15% of them thought about suicide or made a plan, compared to 22% of men. 12% of women in their 40s compared to 20% of men, and 10% of women in their 50s compared to 17% of men. So from 30 and on, men are more likely than women to report having suicidal ideation or say that they made a plan of suicide in the past year. Thanks, Brittany. So we'll now look at access to care. And this one is very interesting because men are less likely than women to seek support when they need it. It's not that they don't need it, but when they need it, and even when they identify that they need it, they're less likely to seek help. So let's look at women on the left again. We can see that 16% of women have access to support the past year. Then there is another 4% in red that said, I felt the need to access support, but I have not done so. So they felt the need to access support, but they did not access support. So overall, 20% of women needed care, whether they accessed it or not. So what's interesting, if you only look at those who needed care, we see that about 80% of women access support when they need it, while 20% of women do not access support when they need it. Now, this ratio is way bigger for men, because we can see that 11% of men, first column for men, access support, and that 6% needed support but did not access support. So overall, 17% of men needed support, but among them, only, I would say, 65% of them accessed care, while 35% of men who needed care did not access care. And this trend is even more significant and visible for younger men under 30 or even under 40, I would say. As for those under 30, 44% of those who needed care and identified that they needed care did not access it. It's almost half of the people this age. So overall, no matter the age, the ratio of men not seeking help when they need it is better than for women not seeking help when they need it. And one thing that is interesting that could be related to the topic of stigma that my colleague Shona mentioned is that we have preliminary results where we can see that men are more likely than women to stigmatize their own mental health. They have internalized the social stigma around mental health, and now they are ashamed and think less of themselves due to a diagnosis. So this could be one lead to explore to explain why men, even when they know they need help, will not say it, will not seek help. So that's interesting. And we are actually collecting now new data on men's mental health, talking about stigma, but also looking at how do men cope if they don't seek help. And we will see, and we will actually ask the question, do they cope by, for example, having a glass of alcohol or smoking cannabis in order to relax, which could also perhaps be a way to explain why there is a gap between men and women regarding substance dependency. We will also look at what made some men access care and not others. What were the triggers that made some men access care that may be lacking for the others to access care? And these are some data that we'll be collecting in the coming weeks, and we'll talk about them in the coming months. So if it's a topic that you find interesting, you can register to a newsletter as some data will be released around this topic. We'll now talk about opioid use. So in the past, we've already analyzed cannabis use and alcohol use and their association with greater mental health challenges. So now we'll focus on opioid use and how is it associated with mental health indicators. So we see that in the past month, 14% of Canadians have used opioids. For most of them, 79%, most of them used it for pain management, whether it's chronic pain or acute pain. Then there is another 10% who used it as part of a treatment for opioid use disorder or to avoid withdrawal symptoms. And as well, 8% who actually used it for a non-medical reason. They used it for the experience or the feeling that they caused. Now, next slide, please. We see that there is indeed an association between opioid use and mental health and substance use challenges. For example, in this chart, we see on the left opioid users, on the right non-users, and we can see that 31% of users report having suicide thoughts or have made a plan of suicide compared to 11% of non-users. 20% of users show signs of alcohol dependency compared to 3% of non-users, and 22% of users show signs of cannabis dependency compared to 4% of users. So there is an association between opioid use and mental health or other substance use challenges. But we'll see in the next slide that it's not a two-way street relationship and that it's a little bit more complex than that. Because we know that most opioid users use opioids to manage pain. And we also know that pain itself is associated with greater mental health and other substance use challenges. So, for example, we see in our surveys that 25% of Canadians currently live with chronic pain. If we look at their mental health and substance use indicators, we see that for people with chronic pain on the left, 20% of them thought about suicide or made a plan in the past year, compared to 9% of those without chronic pain. 40% show signs of alcohol dependency compared to 3%, and 16% show signs of cannabis dependency compared to 3%. So there is an association between pain and mental health and substance use challenges. Also, because we know that pain management often involves medication or other substances. Most of them use over-the-counter pain relievers, but also 15% of them told us that they use alcohol or cannabis to relieve the pain. And some others use prescription medications, whether it's non-opioid or opioids. So that's interesting, I think, to look at these topics in parallel because it's important to understand that opioid use and mental health are associated, but there is this other variable that is pain in between, and it's important to understand the dynamics between those three. So I think we've covered our major topics. Let's have a look at the main takeaways. So my colleague Shona started to talk about AI and mental health. So what's interesting is that younger people and also equity deserving groups are more likely than other groups to use AI in order to seek mental health advice or support. Now, it's also interesting to note that these groups are mostly those who report facing more barriers to care and in accessing traditional care. So it's interesting to see that they turn to AI. Another interesting point was the fact that there is a gap between satisfaction, I would say, and trust. As we can see that 84% of those who used AI find it helpful in order to support their mental health, but that only 17% of the public trust AI to provide safe mental health advice. Then we talked about self-stigma, and we see that 1 in 3 of the people who are diagnosed with a mental health condition feel ashamed of it. So that really talks about the social stigma that has been internalized and now made these people think less of themselves. And it also echoes the fact that people that are actually facing some mental health challenges are less comfortable talking about their mental health than people who do not face these challenges. It really shows that they are not comfortable opening up about these part of them. I then talked about men's mental health, that men are more likely than women to show signs of substance dependency, and they are also much more likely to report having suicidal ideation or having made a plan over the past year. Yet, they are less likely than women to seek support when they need it. And the last topic that we covered was opioid use. We've seen that 14% of Canadians have used opioid in the past year, and it was mostly for pain management. We've seen that there is an association between opioid use and mental health, but there is also an association between pain and mental health. So it's an interesting dynamic to understand who's affecting what between pain, opioid use, and mental health and other substance use. Amazing, thank you. So as I mentioned before, I think the purpose of this webinar was to show you our findings on Canadians' mental health, but also to provide you an overview of our population polling project. If you scan this QR code, you will not only access to poll 25 and 26 reports, but you will also be able to access our previous population poll reports. You can explore them and see if you find any data or visuals that could support your work or your needs. Because these reports, they covered a wide range of topics such as youth mental health, substance use, problem gambling, caregivers' mental health, economic stressors and mental health, etc. So I will invite you all to have a look at it after this webinar. Thank you. So now I think I will let my colleague Shona take the floor and show us our new interactive data hub.
Thank you so much, Claire, for those insights. We're going to spend the next few minutes giving you a quick preview of MHRC's new National Polling Data Hub. You might be wondering, what is a data hub? It's a free online tool that you can interact with to explore reliable and up-to-date information about mental health in Canada. This is a tool for researchers, grant writers, community program advocates, non-for-profit professionals, or anyone who wants to understand mental health trends in Canada and spark some conversations with their friends and family. Our data hub features information from over 100,000 respondents and is collected since April of 2020. We update it quarterly with new data. If you would like to be notified when this new version becomes available, make sure that you are signed up for our newsletter and following us on social media. Diving into the data hub here, let's take a quick tour to see how it works. Everything on this hub is designed to be accessible for researchers, grant writers, and even if you're not used to working with data. It's really important to us that this information is accessible, easy to navigate, understand, and apply, even if you don't have that degree in statistics or have a data analyst on your team. On our homepage, you'll find some information about anxiety, depression, access to mental health support, and indicators. We also have a plain language summary of the highlights from our latest poll in the bottom left corner. I'd like to bring your attention to two of my favorite interactive features. The first is the menu along the left, the navigation menu. This will allow you to visit the different tabs and explore data around mental health, substance use, and access to services. Along the top, we have filters that allow you to customize your data view. Use the interactive drop-down menus to explore some different information about age, gender, province, and equity deserving group. Now that we've finished the tour, let's bring this to life with a real-life example and show you how to access some of the insights we discussed earlier in the webinar around men's mental health. So on the homepage, visiting the filter section, we are going to visit here and select the man from the drop-down menu. You'll notice that our charts update instantly, and we can see that 13% of men reported moderate to severe symptoms of anxiety, and 11% showed severe signs of depression. One thing we can do with this data hub is to quickly compare mental health indicators between gender identities. So going back to our filters, switching to woman, we can now see that our data has updated automatically, and we can see that 17% of women showed signs of moderate to severe anxiety compared to the 13% of men. It's important to note that this filter will remain active as you explore the different pages. So in the interest in discussing men's mental health, let's switch back and head over to the Mental Health Indicators tab. From here, we can explore the prevalence of anxiety symptoms in men and how those levels can change over time. Hover your mouse over the chart to get some different insights. For example, this chart is showing us that between October 2022 and May of 2025, feelings of anxiety for men were high in January of 2024, and the same for depression. Heading over to the substance use tab, we can explore some of the insights that Claire was discussing around the differences between men and women. Here we can dive deeper into those trends and explore them a little bit more. And lastly, visiting the Access to Services page, we can see some information about barriers to care and sources for mental health supports. I also welcome you to visit our methodology page to learn a little bit more about how this data was collected and where it comes from. Heading back to the home page, I want to show you how you can layer filters to customize your experience. So for example, if I was a researcher interested in exploring trends in access to mental health care in younger Canadians in Ontario versus Quebec, we would visit the filters, select our age group, and our province. You'll notice that as the data updates, we can see 26% of 16 to 29-year-olds in Ontario in July of 2025 reported signs of moderate to severe anxiety, and 22 showed severe depression. Drawing your attention to our access to services chart, we can see that 19% have accessed services in the last year. Let's compare that to our younger Canadians in Quebec. Noting our numbers have updated, we can now see 20% show signs of moderate to severe anxiety, 13% show signs of severe depression, and 13% have accessed services in the past year. Overall,
I'm
we can
sorry,
use
it's
this.
Michael. Can I interrupt you for one moment?
Yes, please do.
Just for those who are asking, this is not the current version of the Data Hub. This is a new version that we expect to launch before the end of March. So if you are clicking on our Data Hub link, you will see the old version. This is the soon to be launched version, which we will be putting out shortly. We just had a few comments and it was confusing some people. Sorry, Shauna.
Great. Thanks, Michael. All of this information is available on our website, just in a different format at the moment. This is the new version. Sign up for our newsletter and follow us on socials to be notified when this becomes available. This is the end of our quick tour. We hope this gives you a sense of what the Data Hub can do. Thanks for tagging along. So that's the end of our Data Hub tutorial. We're just going to bring the presentation up to give a couple of previews of what's coming up next, some announcements. So we do have a workplace mental health studentship open right now. We have partnered with My Tax and IA Financial Group on this. We have $15,000 in research funding available. The submission deadline is February 17th, 2026, so that is next week. I encourage you to share this opportunity with your network and anyone who may be interested in applying. We also have an upcoming webinar happening next week that I would like to invite you to, called The Right Not to Remain Silent, Breaking the Silence Around Mental Health in the Legal Profession. I invite you to join us. The link is in the chat to register. We'll now be taking the next few minutes to move into a Q&A session.
Thank you so much, Shauna and Claire. I can't imagine trying to condense 2 years worth of findings into that comprehensive overview you just gave us. That was fantastic. Thank you so much. I know we do have some questions in the chat that I'll be fielding out and might be pulling Michael in at some point as well, seeing how I'm feeling. But we did first get some questions to our email, and I'd like to start with those. So maybe I'll start with Shauna for this question. We got a question asking what surprised you the most that you found in our data in the last 6 months?
Good question, Brittany. Thank you. So many surprising things. I think we're also always finding little gems, but I think for me, it was the mental health stigma that people are feeling when they receive a diagnosis. Despite all of the campaigns, all of the public dialogue, all of the conversations that we have been having about mental health over the past few years, that stigma is still a challenge that we are trying to overcome.
That is a great observation and certainly something that we continue to see and hopefully we'll be able to start to address in the future, starting now. Claire, why don't you take the next one? This one's a pretty straightforward one, and I know we touched on it a little bit, but in different areas. So why don't we just bring it all into one group now? What are the different ways that we can access and use our data that we have available?
Thanks, Brittany. So we can actually access and use our data in many different ways. As I mentioned earlier, there are different ways for us to access our data. You can read our public reports on our website. There are two types of reports. You can access our polling reports, which gives an overview of the overall results of our polls. All topics are can be seen in this report, but there's also the research briefs that are more of a deep dive on a specific topics that are also available on our website. Now, as Shauna demonstrated, there is also an interactive data hub. We currently have an older version that is available, and a new version is coming and will be released in the coming weeks. Now, you can also access our raw data set for free. As I mentioned, if you're a researcher, you'd like to analyze a specific demographic group or a specific indicators your way, then you're welcome to contact us and then access our raw data for free. About how to use our data, they've been used in many different ways. We've collaborated with governments, for example, regarding gambling policymaking decision. We've collaborated around awareness campaign on mental health. We've collaborated last year and they used our data to support their awareness campaign. But we also collaborate with service provider that use our data in order to inform their services and better target them for the people they serve. But we also work with researchers that will use our data in order to inform their research. So if you're a researcher, for example, you can use our data in order to do some analysis and then release a paper on it. But you don't have to use them as a principal source of data. You can also use them as secondary data. For example, if you just want to explore the data in order to see the new trends and get inspiration for a new research topic, you can also use them in order to apply for funding, showing our data and saying that this trend is important and applying for funding for doing further research. But you can also use them as in addition, I would say, probably to clinical data, as we in this population polling initiative, we also ask people who need care but do not access care, those who face barrier and will not be seen in clinical settings. So it can be interesting also to compare the two types of data. So here is how to access our data and some example on how to use our data.
Thank you, Claire. And if you need any of that repeated, that was a lot of information at once. You're always welcome to email info@mhrc.ca and we can point you in the right direction to how to get access to that data. Because we are very proud that this is a massive and free resource. We just want to make sure that the resources we have are used in the best way possible. So again, any information, you can email info@mhrc.ca. And I'm going to move on to a question from the webinar chat, and I might point this one at Shauna, if you don't mind. And that question is, can you provide some more information about your sample population? Are there any limitations or biases you anticipate from your national polling?
Absolutely. So the data that we presented today is collected via online population polling. So it is an opt-in platform that people download and complete surveys. We do have limitations to this because it's opt-in. There are certain populations that we don't have access to, obviously the houseless population and certain people with limited technology and Wi-Fi access. We invite you to visit our data hub or MHRC for all of the ins and outs on our methodology.
Thank you very much. And I think I might bring Michael into the conversation now for a question about AI as a mental health support. And the question we got is, how are people supposed to trust AI with things like mental health when there's recent findings that it has also caused psychosis and other issues in those accessing them?
I think the answer is the data shows that there are many people who still continue to not trust AI, and we're not certainly here to advocate that people do or do not trust AI. It is worth noting that for those who are using AI, they are far more likely to trust it. I don't think that's causation. I think there's correlation there in terms of if you trust AI, you're more likely to use AI. But I also think that if you're using AI, you're more likely to feel like you trust it. And like all things, like all tools that have ever been invented by humans, there are both pros and cons to utilizing those tools and technology. So it's really about the question about how do we utilize it as safely as possible.
Thank you. Yeah, and I think Michael's absolutely right in saying that AI is here to stay for sure. And we at MHRC promote widespread efficacy testing when it comes to these tools. We don't promote just the use of AI bots to support your mental health, but we do promote that if it's going to be here, then it needs to be governed properly and it needs to be researched properly and it needs to be efficacy tested. So I'm going to move on to the next question, kind of in that vein, Claire. I'll go back to you talking about AI supports. Is there a group that we're seeing using AI supports most? Are youth the ones that are tending to use these digital tools?
Thanks, Brittany. As Shauna showed, yes, youth are more likely than older age group to use AI. Now, what she said, and that was also very interesting, is that they use AI in two different ways. Those who identified that they needed care but did not access care, two-thirds of them actually used AI for mental health support. So we could see here that these people used it as an alternative to traditional care because they face some barrier that make them unable, prevent them from accessing traditional care. But we see that youth who accessed support, those who did not face these barriers, there are also two-thirds of them used AI for mental health support. So they used it not as an alternative, but in addition to professional care. So that's very interesting, and we are actually collecting new data now to understand more about this, to understand if they are using AI for mild stress symptoms, for example, getting some breathing advice or understanding how to better schedule things, better plan things. That would be not an alarming use of AI, but we also ask them, are you using it when you have moderate or even severe symptoms that would require professional support? But they actually use only AI as an alternative. That would be more concerning. So we are currently collecting more data in order to understand this new phenomenon.
Thank you, Claire. And I'm going to put this question out to all three of you, whoever wants to jump in on it. We had a question, can you comment on low mental health literacy and how is this connected to your insight around self-stigma? And I know you've all worked on this area a little bit here and there. That's why I put it out to all three of you, whoever wants to take it, or you can each do a little part of it, whatever you prefer.
Michael, would you like to start us off?
Sure. I speak a lot on this topic. I think first off, uh, we are we've seen two significant mental health stigma screeners or tools that evaluate Canadians in terms of mental health literacy as a whole. And our challenge with those have been that there has been this, um, a lot of those questions have to do with prejudicial attitudes towards those with mental health. So the posit of these is if you feel prejudicial towards individuals who have a mental health challenge, you are inherently not literate around mental health conditions, which I don't necessarily see that one-to-one correlation between those issues. So we have stripped away the prejudice questions from literacy screenings we have done where we found about 1 in 4 Canadians would actually pass a mental health literacy um, test. And where we see a lot of failures are on conceptual understanding of correlations between substance use and mental health, but we also see terminology misunderstandings from terms like mental wellness to mental illness to mental health, and people not being able to effectively delineate between those terms. So my contention on this would be that stigma and illiteracy are connected. Certainly, we've seen those. That's why those prejudicial attitude tests exist within those stigma tests. My contention would also be that we would also that when you don't know something, you don't understand something, you're inherently more fearful around it. So we're not going to address proper self-advocacy. We're not going to properly address stigma until we increase general literacy as it pertains to mental health, which remains far too low in this country. That's a general response to your question. I do see correlations and connections between the two, and I do think prioritizing mental health literacy is a really critical step towards advancing mental health in this country.
If I can add something on this topic, if I have time. It's also interesting when we looked at men's mental health. So what we saw is that men are more likely than women to report suicidal thoughts or plan in the past year. But what we see as well is that men are less likely than women to report having mild or moderate anxiety or depression symptoms. So it's interesting to see that men are more likely to report critical mental health state, but less so mild or moderate distress. So that's also interesting in this dynamic to understand what comes from stigma, what comes from lack of mental health literacy in them not seeking help, and how the two feed each other. Because yes, men are less likely, even when they identify it, men are less likely than women to access care. Before that, either men go from feeling good to thinking about suicide, or they also go through, like women, mild and moderate distress that they are not able to identify, which can they then be related to a lack maybe of mental health literacy, or at least of their own mental health, to identify when they start feeling distressed.
Thank you both. And we have one question here that I think is just a good one to clear up, and any of you can take this. Noticing in the findings, you referred to people who participated in the survey as Canadians. So does that mean that we only pulled Canadian citizens, or were other folks who are in Canada but not citizens also able to, given the opportunity to participate?
It's anyone located within Canada. We classify them as Canadians. They have to be able to register for the service. But we don't ask for any proof of citizenship or anything along that lines. We do have representation from a number of individuals who identify as refugees, newcomers to the country, and a host of other indicators that we have on that front.
Thank you. And I think we should maybe do one more before I hand this off to sign off. Just somebody looking for a little bit more information on what measure we use to measure mental health literacy. And I know this is an ongoing process and an ongoing conversation, so I'll hand this over to whoever wants to take it. But I know, Michael, you've kind of been involved in mental health literacy for the longest out of us as a group. So why don't you take
Yeah,
this?
so there's one, sorry, there's one that there's two. I can't remember the name of the other literacy screener that was used. The one that we've leaned on more recently was developed by mentalhealthliteracy.org, which is Dr. Li Feng Wei out of the University of Alberta, has developed that, and we use a short form version of that. That was developed by mentalhealthliteracy.org. I think it's a 5-question literacy test, which we've basically extrapolated one question from different categories of mental health literacy, but there is another one, and I'm afraid the name of it escapes me at the moment.
Thank you, Michael. And I know we're a couple minutes before 4 o'clock, but I know some people, or 3 o'clock, sorry, I'm on the East Coast, but I know some people are running off to their next meeting, and it's nice to have a couple minutes before you have to dive into the next one. So I'm going to hand this off for our sign off to Claire, I believe.
Yes, thank you so much, Brittany, and thanks, Shauna and Michael, for answering the questions. Yes, this webinar is now closing. Thank you all so much for joining us. I hope we answered most of your questions, although if you have some pending questions, you can contact us at info@mhrc.ca. As Shauna mentioned, there is another webinar coming on February the 18th, focused on the mental health within the legal profession. So if you're interested in this topic, please go on our website. You can register. There's a link on our homepage. You can also register to a newsletter on the foot page of our website. So thank you all very much, and thank you so much to all the presenters in this webinar.
Thank you, Claire. Thank you, Shauna. Thank you, Brittany.